I'm Sean Reynolds. I help people understand health insurance. I'm the president and a licensed agent with Cavalier Insurance Group. The purpose of this video is to show you how to insure just children. If you found yourself in a situation very similar to state employees of Oklahoma recently, including our public school teachers, the rates for insuring children more than doubled. For many of those people, they're just going to need to find something else. So what I'd like to do is go through kind of a refresher of what the typical insurance plans do, how they work, and show you an alternative that may be a nice way to save you some money, but still protect your kids. In this particular situation, state employees, including our public school teachers, are seeing a major increase in the cost of their insurance if they want to put them on the Blue Cross Blue Shield plan. You may not be a state employee, but you may find yourself in a similar situation where your boss has increased this cost, or wherever you get your insurance, now the kids cost more. So you may want to split them off and put them on their own policy. That's what I want to go through today. But just take a look at the increases here. The prices went from crazy to ridiculous. It's 142.5% increase, or $1,269 a month. Those folks are going to have to do something else. But before they go to the health choice options that are also available through the state, it's important to take a look at how this type of insurance works, because it may not be a good fit if you're insuring just children. What you want to do is consider what type of care does your child need. And you probably fit inside one of two camps. You're either managing ongoing health concerns, that's going to involve doctor visits and testing and perhaps expensive medicines, things of that nature, or your kids are relatively healthy. They might get a cold, flu occasionally, have the usual, accidents that kids have, or you just want access to urgent care, maybe telemedicine, and then you always want to do the annual physical. You probably would insure those kids differently. The one who needs more ongoing care versus the one who really needs just acute care. So let's take a look at how that would work. First of all, let's take a look at what is known as kind of standard health insurance, or an ACA qualified plan, or a major medical, or something from the marketplace, or the kind of stuff you usually get from work. Here's the upside of that. There's no cost for wellness care. There's an out-of-pocket maximum. That's probably the thing that people like the most about it, because it provides a cost ceiling that limits exposure to the big bill. Now, another upside is, well, if you're getting it through work, your premiums are deducted through payroll. What about the not so good, the downside? Well, we already talked about cost, since you just got priced out and you need to do something else. But consider this: if you're out of network, it's likely your insurance will not pay any benefits at all. There may be an exception if you are receiving emergency care. Otherwise, chances are it's not going to pay anything. You have an annual deductible to meet before it will pay any benefits toward illness or accident. Pretty standard figure out there these days is $5,000. If you have not met that figure, anything that is accident related, anything that is illness related, that is not considered wellness, you will pay 100% for until that deductible has been met. Then you get into co-insurance. That's where you split the cost with the carrier. More common on the marketplace these days is 70-30, 60-40, 50-50. Can you imagine? Still responsible for half the cost of your care until you reach your out-of-pocket maximum. These days it's $85.50. You may still see copays and fees. So even if you reach that amount, there's still more that you're going to pay. You may want to round it up more like to $10,000, maybe $11,000 for the year if you actually did max out. So I think you noticed there's kind of a pattern here, and that's you pay, and you pay. Do you like that? I know I don't. Let's take a look at how this coverage would work in a real life scenario. A client of mine experienced this. It was late night on a Saturday night. His daughter was making some popcorn. Things got a little buttery. She slipped, she fell, she hit her chin on the counter. She then ricocheted off the counter and she face planted. She bit through her bottom lip. She got 3 stitches here, 2 stitches here. 5 stitches for a total of $2,500 in the emergency room. That's the scenario. So how does that work with typical insurance, including the kind that you get from the state? If the annual deductible is not met, you pay 100% of it. It's that simple, $2,500. You get no help. An emergency room access fee may apply, but you know what? That's not charged by the care provider. That is actually charged by the insurance company, and you get absolutely no benefits for it. Kind of a disincentive to use the emergency room. But in this particular situation, my client had no choice. It was late night on a Saturday. Urgent cares weren't open, and her primary care physician was not available. So your total is not just $2,500, but you get that access fee too. It would be $2,900 or up to $3,650. And you're thinking to yourself, but I have insurance. You do, provided that you've met the deductible. You're gonna get tired of me saying that, I assure you. Now, my favorite coverage involves multiple policies, actually 4 policies, and 2 of them are going to pay benefits in this particular situation. Policy 1 is an accident-only policy. It pays up to $4,000 in care costs for any individual injury. In this particular situation, they had to pay a $50 deductible because they used the emergency room, but otherwise, it covered the bill, $2,450, so they'd owe $50. Now, there is a second policy that is going to pay benefits. That policy, and I'm way oversimplifying, pays benefits for outpatient care, urgent care, inpatient surgeries, hospitalization, all kinds of stuff. Depending on your level of coverage, it also would pay $600 or $800. Well, take 50 of those dollars, pay your balance due. That leaves you $550 or $750 to do with whatever you like. The bill is paid. So when the bill is paid and you have extra benefits, you get to keep that money. So with Cavalier's favorite coverage, it covered the bill with a benefit surplus of either $550 or $750. Now check this out. Policy 1 for a boy or a girl under 19 years of age is $20.13 a month. Weren't we just talking about $1,269, $544 a month? Look at that, just that one piece took care of almost all of it, and that's that inexpensive. Look, even if you don't like anything else that I present to you today, if you have a high deductible policy and you have children, you need to talk to me about getting that coverage, because if your kids get hurt, I'll eat up $4,000 of deductible right there. Policy 2 varies by the gender and the level of coverage. So you see the rates for the boys and the girls. So compared to the rates for the state coverage, I have a lot more room to go to get you more coverage to even come close to what those other premiums are for those other policies that certainly underperformed in this situation. I specifically chose an accident situation because children are far more likely to be injured than they are to become critically ill. In this situation, with a plan that has a minimal deductible or no deductible unless you're hospitalized, that's a much better fit for insuring children. But otherwise, for the everyday type of stuff, we have 20 paid doctor visits per year. My Oklahoma clients, when they go see their primary care provider, they don't pay anything to see them. There's no copay, and the benefit that the plan pays is enough to cover the visit. So when they go see their doctor's in network, they just show them the insurance card, and that's it. They get a little check in the mail later. We have no cost telemedicine. Those visits are unlimited, so you can use it as much as you want to, either as a convenience or a necessity. We have strong urgent care benefits. We pay either $300 or $400. Most of the types of things that family use urgent care for, those visits cost considerably less than that. You're actually seeing an incentive to go there instead of the emergency room. Now, this plan has no deductible unless you are hospitalized. And what's great about that is if for some reason you need an outpatient surgery, there's no deductible. Right there, that's going to make the cost of that surgery less than if you had a plan that was going to charge you a deductible, but also you have to stay in network. And chances are the cost for that surgery in network is far greater than other places you can go because you can go wherever you want to. For example, Surgery Center of Oklahoma would be an outstanding choice. Very affordable rates. Most of the doctors and surgeons who work in the major hospitals also perform surgical procedures there, so there's no talent drop-off. Outstanding, great flexibility. So what about the big bill? What about catastrophic care? Okay, well that's where policies number 3 and number 4 come in. They provide umbrella type of coverage. They pay the usual and customary charges, dollar for dollar. One is for illnesses, the other is for accidents. Now, we have 4 deductible options, but for kids, we recommend the lowest deductible. Want to make sure that you don't end up with a big bill by choosing one of those higher deductible options. But you can choose a maximum benefit amount of $250,000 or $500,000. There's a lifetime face value of $2 million on these policies. These plans are guaranteed renewable. They're not short-term policies, which you've probably also seen before. So you need to recuperate within a short amount of time or you're just out of luck. Not at all. So let's get to brass tacks. What does it cost? So you see those figures, $544, $309, $251, $218. That's the cost for the state coverage for one child. I have plans starting at $167 for a male or $182 for a female. You can add more kids to that, because what's going to happen is that first child is going to be the primary insured and the additional kids are going to be dependents. Dependents are less expensive, so much so that each additional child is only $53.22 once you started with the boy at $167 or the girl at $182. So a boy plus one, $219.55 per month. A girl plus one, $232.02 per month. That means that I can cover 2 children for less than the cost of 1 child on any of these other plans, save for the super high deductible plan. That is a great value. Okay, so let's look at rates for children. That's the big increase there. $1,269 for 2 or more kids, $525, $425, $368. Okay, let's throw more coverage at there. So let's say this is a situation where you want more protection from COVID or 50% more hospitalization benefits or things of that nature. That plan is $196 a month for a boy or $223 a month for a girl. Each additional child is $137.14. So for a boy plus one, it's $333.15 per month. A girl plus one is $359.67 per month. Now let's compare that to $1,269, $525, $425, and $368. I beat them all. And that coverage is stellar. Now, I created this so you could take a look at it at a very high level. I'm sure many of you have specific questions to ask, so you know whether or not this is a good fit for your child or your kids. Fair enough. Well, send me your questions. You can email me at Sean@CavalierInsuranceGroup.com. I'm on Facebook. You can send me a message through Messenger at Cavalier Insurance Group. You can also call or text me 405-421-7660. Open enrollment is coming up for a lot of people. If you enjoyed this video and you think I have something that may be helpful for your friends or your family or other associates, let us help. So whether that's marketplace coverage, and I'll tell you what, get a local agent. Don't just sign up for marketplace coverage. I can advise you on low-cost care options that marketplace isn't going to tell you about, and your insurance company certainly isn't going to tell you about, that can help you save money regardless of what insurance you have. But sign up through Cavalier if you want to take advantage of that. We also have coverage for those who are earning too much money to get a tax credit or a subsidy for their insurance. This private insurance I showed you for the kids works very well in that situation, especially folks who are looking to retire. This can be a great option for them. Young adult coverage looks very much like this coverage for kids, just a slight tweak to that, and I'd be happy to explain that for you. Of course, this insurance also works well for the self-employed. We also help with group packages like this. We also have group coverage that's more of the traditional insurance. If for some reason you have people who would not medically qualify for this coverage, or you're just more comfortable with that style of insurance, we can save you money with that. Plus, Medicare. We have Medicare agents. I'm going through Medicare training myself, and we'll have that completed very soon so I can assist clients who are inquiring about Medicare coverage. So again, I'm Sean Reynolds. I help people understand health insurance. This is my contact information. Again, please don't hesitate to reach out to me. We're Cavalier Insurance Group, your faithful insurance companion.